Hi besties, it's V again. Yeah, Nurse V, and we're about to have some gist. You know how we do it. I'm so glad to see you again. Now, remember we said that we were beginning a mini series, and it was on vulva and vaginal conditions. Today, we're going to commence with a condition that affects the Bartholin duct. The Bartholin ducts are tiny openings that are located on each side of the vaginal opening. Let's do a little recap. Remember how we said that the vagina is located within the vulva. So when you take a mirror and then you look underneath, you'd find the lips. Those lips are the vulva lips. When you pat it from the top, front backwards towards the anus, we said that we have the clitoris, and then a few inches after that is the urethral opening. After the urethral opening, where pee comes from, then we have the vaginal opening. The vaginal opening, on both sides of the vaginal opening, left and right, we have two tiny dots. You almost wouldn't see it. They almost go unnoticed most of the time. However, those ducts or openings are called the Bartholin duct. So that is where your Bartholin ducts are located. These ducts are really tiny, like I said. And guess what? They measure as tiny as 1 centimeter. That's it. It's really tiny. What is the function of these ducts? Someone would ask. The ducts actually have one function, and that is lubrication. They produce or secrete the fluids that helps us get lubricated when we're sexually aroused. So when you say, oh, I'm wet, that is what the Bartholin ducts do for you. They get us wet when we're sexually aroused. There are two main conditions that affect the Bartholin ducts or Bartholin gland. Just two. The first one is the Battlin Cyst, and then we have the Battlin Abscess. What happens when someone has got Battlin Cyst? It's very simple. So we say that when someone has Battlin Cyst, it results mainly from a blockage of the Bartholin ducts. And when these Bartholin ducts gets blocked, it retains fluid in it. So it starts accumulating fluids. So the fluids which were meant to be secreted becomes accumulated and stays inside. When this happens, it will automatically lead to what we call the Bartholin cyst. Someone would ask, what did I do that caused me to have a Bartholin cyst? Well, there are really no explanations for that or reasons for it. Sometimes it just happens. However, there's some things that have been found to be linked with it. And this one of it is actually sexually transmitted bacterial infections. So when you get infected by a bacteria, which we get that is being transmitted sexually, this is one of the causes of Bartholin cyst or blockage of the Bartholin duct. Here are the examples: gonorrhea and chlamydia. So when someone has gonorrhea and chlamydia, there is a high chance that they could come down with Bartholin cyst. Another bacteria that has been found to be associated with the cause of Bartholin cyst is E. coli. E. coli is usually found in our lower intestines. That's where they affect. Remember how we said it was imperative that we do clean from front to back to avoid poop or whatever matter from getting in contact with our vulva. This is one of the reasons. When you do clean from back to front, which is the wrong practice, you introduce or you increase the risk of introducing poop, which will be containing E. coli, into the vulva. So, always remember that wiping from front to back is the good and perfect practice. Yeah. How do I know that I have Bartholin cyst? Some people can have Bartholin cyst and show no symptoms, meaning it's asymptomatic. So you wouldn't know. You just perhaps feel a bulging. That's if at all there is a bulging. For some other people, they do experience pain, an unbearable kind of pain. So when you experience that pain, you're forced to, of course, inquire, what's going on with me? Why am I having pains there? When the Bartholin cyst becomes painful, do not panic. There's actually a home remedy for it. And you know what it is? It's very simple. Just get some warm water, and soak that area in warm water. It will help to unblock the pores or unblock the openings. Yeah. If you cannot do that, you can also get a towel or a clean napkin. You soak it in warm water and then you apply the compresses over them. Someone would ask, how many minutes do I do this for? You can apply that for 8 to 10 minutes at a time, several times in a day. Now you do this 8 to 10 minutes, 3, 6, depending on, the number of times you can do that for a day. And then you do this over 3 days. If after 3 days, you discover that it's not going, it's not getting better, then you have to seek for a health professional. Go and see your health professional. The second condition that affects the Bartholin duct is Battlin Abscess. So the Battlin Abscess is actually an extension of the Bartholin cyst. So when you have an untreated Bartholin cyst, it becomes infected. And that is what we call the Bartholin abscess, where you now discover that there is accumulation of not just fluid, but pus. So there is pus and then there is severe pains, unbearable pains. The pain might not be unbearable, but there is pain and there is pus. Those are the two symptoms that will let you know that your Bartholin cyst has moved from just Bartholin cyst to Bartholin abscess. At this point, it means that there is an infection. So you have to seek for medical help. 2 ways of treating this. It's either you be given antibiotics, and when you're given antibiotics, if this is resolved, then there will be no need for the second mode of treatment. The second mode of treatment is where they will have to do a drainage for you. So say that the Bartholin abscess doesn't get resolved, there will have to be a drainage done for you, an incision and drainage procedure. But not to bother your head. The medical professionals have it covered. What group of girls or women are high risk for these conditions? Bartholin cyst does not affect young girls. And by young girls, I mean girls who haven't attained puberty. Now, this is because if your girl child hasn't attained puberty yet, it simply means that their Bartholin ducts are not even functional or active at the moment. So they can't even get blocked. However, in cases of sexually active women, they are at higher risk for having or for experiencing Bartholin cyst or Bartholin abscess, just because they are sexually active. And the age range is between 20 to 30 years. Yes, women within the age of 20 to 30 are those who are high risk for developing Bartholin Cyst. And also, like we said, sexually active women. Remember that we said that poop could actually also cause it. I mean, the bacteria that is in poop. So, with that, it means that whether you're sexually active or not, and you do not do proper vulva hygiene, and you do not follow the proper practice of cleaning from front to back, you put yourself at risk. Yes. Now, good news for the postmenopausal women. They are not at risk. Why? Because the Bartholin ducts actually do shrink as you attain menopause blockage, because there is no secretion anymore. It's not functional, so it doesn't even bother to get inflamed or infected. Yes, we've come to the end of today's condition, which is, do you remember? Ding, 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 ding. Battlin Cyst and Battlin Abscess. Thank you so much for your time. We look forward to your questions. We look forward to your contributions. And till we'll see you next time. It's bye, guys. I love you, besties.